Depression is a common and serious mental health condition characterized by persistent feelings of sadness, hopelessness, and loss of interest or pleasure in activities. It can affect various aspects of a person's life, including their emotions, thoughts, behaviors, and physical health. Overcoming depression effectively requires a multifaceted approach that addresses the underlying causes, symptoms, and triggers of the condition. Here's a detailed overview of depression and strategies for overcoming it. Understanding depression. 1. Types of depression. Depression can manifest in different forms, including major depressive disorder, persistent depressive disorder, dysthymia, bipolar disorder, seasonal affective disorder, and postpartum depression. Each type may have distinct symptoms and treatment approaches. 2. Causes and risk factors. Depression can result from a combination of genetic, biological, environmental, and psychological factors. Common risk factors include a family history of depression, traumatic life events, chronic stress, imbalances in brain chemistry, medical conditions, and substance abuse. 3. Symptoms. Symptoms of depression can vary in severity and duration but may include persistent feelings of sadness, anxiety, irritability, fatigue, changes in appetite or weight, sleep disturbances, difficulty concentrating or making decisions, feelings of guilt or worthlessness, and thoughts of self-harm or suicide. Overcoming depression effectively. 1. Seek professional help. If you're experiencing symptoms of depression, it's important to seek professional help from a mental health professional, such as a therapist, psychologist, or psychiatrist. They can provide an accurate diagnosis, develop a personalized treatment plan, and offer support and guidance throughout your recovery journey. 2. Therapy. Psychotherapy. Therapy, such as cognitive behavioral therapy, CBT, interpersonal therapy, IPT, or mindfulness-based therapy, can be highly effective in treating depression. Therapy helps individuals identify negative thought patterns, learn coping strategies, improve problem-solving skills, and build resilience. 3. Medication. Antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, or tricyclic antidepressants, TCAs, may be prescribed to manage symptoms of depression. It's essential to work closely with a healthcare provider to determine the most appropriate medication and dosage based on your individual needs. 4. Lifestyle changes. Making healthy lifestyle changes can play a significant role in managing depression. This includes regular exercise, balanced nutrition, adequate sleep, stress management techniques, such as mindfulness meditation or yoga, and avoiding alcohol and recreational drugs, which can worsen symptoms of depression. 5. Social support. Surround yourself with supportive friends, family members, or support groups who can offer emotional support, encouragement, and understanding. Social connections and meaningful relationships can help alleviate feelings of isolation and loneliness associated with depression. 6. Self-care. Practice self-care activities that promote relaxation, enjoyment, and self-compassion. This may include engaging in hobbies or activities you enjoy, spending time in nature, practicing relaxation techniques, such as deep breathing or progressive muscle relaxation, or seeking out creative outlets for self-expression. 7. Set realistic goals. Break tasks into smaller, achievable goals to avoid feeling overwhelmed and increase feelings of accomplishment. Celebrate your progress, no matter how small, and be patient with yourself as you work towards your goals. 8. Stay engaged. Stay engaged in activities and routines that bring meaning and purpose to your life. This may include volunteering, pursuing hobbies or interests, setting meaningful goals, or participating in community or social activities. 9. Monitor your progress. Keep track of your symptoms, mood changes, and treatment progress over time. Use tools such as mood journals, mood tracking apps, or self-assessment scales to monitor changes and communicate with your healthcare provider about your progress. 10. Stay hopeful. Recovery from depression is possible with time, treatment, and support. Stay hopeful and remind yourself that healing is a gradual process. Be patient with yourself and focus on taking one step at a time towards improved mental health and well-being. Remember that overcoming depression is a journey that may involve ups and downs. It's essential to be patient with yourself, seek support when needed, and prioritize self-care throughout the process. With the right treatment, coping strategies, and support network in place, you can overcome depression and reclaim your life. If you or someone you know is experiencing thoughts of self-harm or suicide, seek immediate help from a mental health professional or emergency services.